Testicular cancer occurs usually in young men between the age of 20 and 40. Usually patients feel a lump there, and that's the commonest way of presenting. Testes cancer has been transformed over the years. You may have heard about Lance Armstrong, who had spread throughout his body, who's now cured of his cancer. And so this is a cancer that we've had a great victory over, because a certain chemotherapeutic agent, cisplatin, works very specifically to testes cancer. Having said that, the majority of patients do not need to have chemotherapy, nor do they present with evidence of spread. Usually they present with a firm lump in the testes. Generally, the way it's treated is we do a radical orchidectomy. We remove the testes and the spermatic cord, and that testes is removed and sent for pathology and analysis. Patients are usually in hospital overnight. Now, prior to this, we do some staging tests, such as a CT scan and a chest x-ray, to make sure there's no evidence of spread. When we get the pathology back, at the time of surgery, we also give the patients the option of having a prosthesis inserted, a testicular prosthesis. So young men who are not married, may wish to have that put in, and we put a little synthetic prosthesis in, and externally it appears very similar to a normal testes. So when we get the pathology back, we divide testicular tumours into two groups, seminomas and non-seminomas. And it's a very complex topic, so we normally would refer you to an oncologist to discuss subsequent treatment. But usually with non-seminomas, we follow an observation protocol. So we would do regular CT scans and monitor the situation. With seminomas, traditionally, patients got radiotherapy to the aortic area, where testes cancer would first spread to. These days, we tend to also offer an observation protocol for those patients. So the important thing with testicular cancer is there's an extremely high cure rate with testicular cancer, and it's important for patients to self-examine. The treatment is a radical orchidectomy plus or minus some adjuvant treatment if required.